Welcome to the Chiropractic and Legal Injury Podcast, recorded live at our events. We're here bringing you the expertise, insights, and tools you need to navigate the world of personal injury care and to uncover what you didn't know about car accidents. It's no accident you're listening today, so let's get started.
All right, we are here with Dr. Kate Brungard, a chiropractor here in Arizona. Tell us a little bit about yourself.
Well, like you said, my name is Kate. I grew up in rural Iowa. I went to school in Marietta, Georgia for my chiropractic degree. I practiced in New Jersey for about 7 years where I did interventional pain. And I moved to Arizona about 2 years ago where I've been practicing in Gilbert ever since.
That's amazing. So what made you leave New Jersey to come to Arizona?
Property taxes, and I like the sun.
Well, you don't have to shovel sunshine, as they say.
That's true.
Well, it's great to have you here in Arizona. And from what I've gotten to know about you over the time that we've known each other, you do excellent work, take great pride in the work that you do here. So Arizona's very lucky to have you.
Thank you.
All right, so tell us a little bit about your practice. So what does your typical case look like, and what type of treatments do you provide at your clinic?
We are mostly a chiropractically based clinic. We also offer massage therapy, and we do a little bit of rehab as well. What I like to do is I really like to be active in the case management of all of the PI cases specifically that come into the office. I also like to order advanced imaging, and I like to be very involved as far as the referrals out to specialists. So whether that means that they need to see neurology, pain management, neurosurgery, a lot of times PTSD counseling, I like to be very involved as far as talking with the attorneys and also with the other doctors.
It's almost like you've attended some of the advanced injury seminars that we're putting on over here.
A couple.
We have a unique one coming up in January, as you know, and we're putting together a multidisciplinary panel, which has never been done before in the continuing education world here in Arizona. So tell me what you're looking forward to the most about that.
I think that this seminar is just going to be the beginning for Arizona and what's to come. PI can get extremely complicated, and I think if every chiropractor in Arizona knows how to handle a PI case that comes into the office, you can do anything.
Yeah, that's true. Well, what inspired you to become a chiropractor?
I suffer with facial pain and migraines as a result of some sports injuries, and I had kind of gone through the gamut of some medical professionals, and after a couple of years, I was still feeling pretty terrible, and I went to the chiropractor in my hometown in Iowa, and I started to feel a little bit better. And I noticed that there was a disconnect here between not only alternative medicine and Western medicine, but also a disconnect between all of the other specialty providers in Western medicine. And when I decided that I wanted to be a chiropractor, I wanted to be the kind that was involved in co-managing and cooperating with other professionals, playing in the sandbox. So when I treat a patient, I'm also thinking of who else can I get involved with, who can I co-manage this with, what does this patient need, not how can I be the only person to help this patient.
That's great. That's a wonderful approach to take. So as you know, over the last 10 years, you've seen a much larger fluctuation of female chiropractors entering the profession. Typically, it's a very male-dominated profession. And what would you say to somebody who's considering a female, who's considering a career in chiropractic?
Yeah, I never really thought of it as a male-dominated field. There is a huge opportunity for anyone who wants to be a chiropractor, specifically females. You don't necessarily have to do interventional pain and personal injury like I've chosen to do. There's a lot of niches, and there's a lot of different specialties that you can do. There's sports injury, there's prenatal, there's newborns, there's biomechanics, biophysics, so many different things. So what I would recommend doing is going and shadowing several different kinds of practitioners to see if there's something that kind of speaks to you and something that you really would like to do. So it's a great degree, and you can use it to your advantage in whatever way that you like.
You mentioned that you enjoy working on personal injury cases, so
yes.
I would love to know what your experience has been like working with attorneys, working with adjusters, and what tips would you give to attorneys who are looking to work with your office?
I think a lot of people are surprised when the chiropractor reaches out and kind of extends the olive branch first, and it's like, this is what I know, this is what I'm going to do. I like to send out the first day's notes to the attorney and sometimes even to the adjuster. And then I like to tell them what my plan is going forward, let them know, this is what I'm seeing with the patient, this is my plan, and then I'll kind of let you know and keep you updated as the case goes along. And then as far as the attorneys working with the office, I like to keep them involved and let them know what's going on as far as the case is going on as well.
That's right. That's wonderful. I get asked all the time, if you could pick one case that you would define as the highlight of your career or your greatest professional achievement, what would yours be? Tell me the story about your greatest achievement as a chiropractor.
Oh, man. I don't know about my greatest achievement case, but I think the first time that I had a PI case in Arizona, I realized how much I didn't know because I came from a PIP state and I knew how to treat, I knew how to diagnose, I knew how to refer, and I knew the laws in New Jersey really well. And then when I came out here, I still knew all of those things, but I didn't know the intricacies as well as I thought I did. And it really made me dig in deep, and then that's what initially made me come to your seminar in August. And
that's great.
That's kind of what started this whole thing.
Sure. I'm also licensed to practice law in New Jersey, and I know firsthand the laws are so different in New Jersey than they are here.
Yes.
And it's funny because I've gotten referrals for cases in New Jersey, and I'd look at the law, and it is so different than what's here in Arizona. Mm-hmm. The thresholds are different, the roles of the physicians are different, mm-hmm. and it's like a completely different world. So I imagine that must have been a little bit of culture shock for you when you made the switch over to Arizona.
Absolutely.
I personally like it better here. I like practicing personal injury law here a lot mm-hmm. better. I think it's more streamlined. I think it's less litigious than it is back east. What has been your experience in that regard?
Absolutely, yes. Once I understood some of the different terminologies, I do feel like I have a little bit more freedom, a little bit more leeway. I'm not asking for the first 12 visits up front. I do feel like I can exercise my chiropractic degree a little bit more than I could in New Jersey. So
okay.
It's been a really good learning experience.
That's great. All right, somebody's in a car accident and they're thinking about presenting to a chiropractor. What piece of advice would you offer them and how to go about selecting the right one for them?
If your chiropractor does not regularly do personal injury, I would try to find one that does personal injury regularly, because people that do personal injury will send them back to your normal chiropractor. As far as picking someone that does personal injury, I would look for someone that's ATMI certified, or I would pick an attorney and then ask your attorney who they work with that typically would get them higher settlements and they work with really well. And then I would go back to your regular family wellness chiropractor.
That's great. That's a great piece of advice. So, is there anything else that you would like us to know about you or your practice?
No, not particularly, but I would recommend if anyone is in an accident, even if you don't think that you're hurt, I would recommend getting checked out by any sort of physician. A lot of times I take x-rays of patients and I will see on the x-rays an old whiplash injury, and I'll ask them if they've had an accident within the past 5 or 10 years, and they'll say, oh yeah, I think I had an accident, but I didn't think I was hurt, I never got checked out. And years down the road, I'm cleaning up old messes, essentially. So
sure.
Even if you are in an accident, you don't think you're hurt, please get checked out.
That's great. All right. Well, Dr. Brungard, it's always a pleasure, and thank you so much for joining us today.
Thank you so much, Larry.
All right.
From all of us at the Lazzara Law Firm and the Chiropractic and Legal Injury Conference, thank you for listening. We hope you never need us, but if you or someone you love does, know they'll have a team dedicated to helping them rebuild, recover, and reconnect with what matters most, their loved ones and the life they deserve. This is the Chiropractic and Legal Injury Podcast, where knowledge is power and collaboration transforms care. If today's episode opened your eyes, share this podcast with your network and help spread the word about the realities of personal injury care. Follow us on social media to keep learning and connecting with this incredible community.